We're super excited to have you guys here for the fourth session of our Echo Light training series, supporting the whole child, connecting brain health systems and practice. So I'm super excited to get to introduce today's speakers. First, we have Austin McGuire. Austin McGuire is a licensed psychologist and assistant professor in the Division of Developmental and Behavioral Sciences within the Department of Peds at the University of Kansas Medical Center. He received his PhD in clinical child psychology from the University of Kansas and completed his clinical internship at the Medical University of South Carolina, followed by a 2-year T32 fellowship in the National Crime Victims Research and Treatment Center. So clinically, Austin provides outpatient psychotherapy to children and adolescents with a focus on adversity exposure. His research focuses on how understanding how adverse experiences such as maltreatment and community violence impact youth well-being, particularly around children and families that are involved in the child welfare system or living in poverty, as well as improving the implementation of evidence-based assessment and treatment for that population. So we're super excited to have Austin join us today. We're also joined by Jenny Stroop. Jenny has a bachelor's and master's degree in social work and is licensed in the state of Kansas. Jenny's worked at Sunflower House for almost 14 years and has spent the last 5.5 years as a forensic interviewer and has interviewed over 875 children. Prior to being a forensic interviewer, Jenny worked as a family advocate, and she also has prior experience working at DCF. So together, our two speakers today really bring those different perspectives that the series is all about, and we're super excited to have them both.
To our discussion. I have a quick question for the group, and if you all, I'm going to give everyone kind of 20 seconds to put in the chat their answer to this question, or your guess to this question, about what % of youth might experience a trauma before adulthood. So if you all want to take a guess, a percentage, number, put that in the chat. Awesome. I appreciate the guesses. Yeah. Yeah, well, it seems that you all have a pretty good understanding of this. Again, these are great percentages that are very much the percentage that I had. So, again, unfortunately, it is a high number, and as we say, it's often the rule rather than the exception that kiddo has experienced at least one traumatic event before adulthood. With our national prevalence estimates and statistics really suggesting that 70% or more have experienced at least one event. And considering the types of events that really go into this number, we know, a large portion of these youth have experienced confirmed maltreatment with about 10 to 15%. Again, the majority of that being exposure to neglect, followed by physical abuse and then sexual abuse and emotional abuse. And again, really highlighting that this is confirmed maltreatment and likely probably an underestimate of the actual percent of exposure of abuse that kids, or child maltreatment that kids experience during childhood. Moving beyond that, another large percentage of youth tend to experience different forms of violence. This can be violence in the home, violence in the community, violence as part of their social relationships that they have throughout childhood. And also recognizing too that a lot of youth will experience the death of a close individual, whether that be a sibling, a caregiver, or other type of close adult in their life. And again, this is only a small group of the different types of events that kids can experience. There's things like natural disasters, mass violence incidents, shootings, things like that also make up this very high percentage, unfortunately, that we have, primarily, thinking about kids in the United States. Now, another question for the group is what % of youth experience more than one trauma? So again, if you all would be willing to take a guess, put the percentage that you think in the chat. Give you all a little bit to do that. Awesome, awesome. I say, I don't know, Haley, I don't know if you sent out the slides before, but everyone is having really great guesses today. Because yes, again, also a high number. I like the description of that. And again, unfortunately, we do know that it is kind of the rule rather than the exception. And again, that most youth have experienced more than one type of event. And so this really relates to potentially a term that you all have heard regarding things like polyvictimization or cumulative trauma. With the Adverse Childhood Experiences Study or ACEs study, this became very popular in the late 90s, early 2000s, and regarding this recognition that, it's not just one event, it is a lot of different types of trauma that children unfortunately experience throughout childhood. And another thing that we really wanted to highlight today as part of our presentation was, there is kind of that what we might call the index or the primary trauma that a child might experience, but that's not really the whole story. And there is a need to consider what we might call these secondary stressors or secondary traumas. And these are different types of events, different types of stressors that might be a result or a consequence of experience of trauma. So what I have here is an example of a kiddo that I worked with a couple of years ago. This kiddo was living in a single parent household, and his caregiver had died in a car accident. And him and his sister, as a result of that car accident, then were placed into foster care and placed with kinship relative in a nearby city. And as a result of that, had to change schools, lost contact with their friends, and this new school system wasn't following or had a different curriculum, different educational curriculum than the one that is old school. So then he started to have academic challenges as well. And so as you can see already, we have the car accident, we have changes in household, changes in school, changes in social relationship, difficulties at school now, all kind of part of this one single event or as a consequence of this one single event. And as we know, unfortunately, for kids in the foster care system or those that are involved in the child welfare system, they often have to change places, so change placements. And this happened in this case too, where unfortunately this relative was no longer able to support my patient and their sister, and so they were placed with another relative. And unfortunately, this relative also tended to use very severe corporal punishment or physical abuse. And so again, continued exposure to these secondary stressors or secondary traumas. So again, to kind of wrap up, this section, against the rule rather than the exception that children tend to experience trauma and that they tend to experience more than one traumatic event. So now I will pass it to Jenny, who
All
will talk
right.
about child advocacy centers.
Yeah, thank you, Austin. So now that we've talked a little bit about the prevalence, we want to talk about the system involvement and what that may look like for children and families who have experienced some sort of trauma. So the first thing that we need to do is just talk about what do we do once we have a concern. Concerns can come to you in different ways. It may come through a child telling you that something has happened. It may come through an observation that you have. It may come from stumbling upon information such as like a note or a journal entry. But once you have concerns or a suspicion that something has happened, we encourage you to gather minimal information from the child about what has happened. It doesn't need to be very in-depth. You just want to gather information about who was involved in what happened, what's that person's relationship to the child, if the child is able to tell you that, what generally happened without going into too much detail, and then where did the incident occur? Overall, we just want to limit the number of people that are talking with kids about the concerns or about the allegations because we don't want kids to have to repeat themselves unnecessarily. Talking about it over and over can have a negative impact on the investigation, but also on kids as well. It's really important to remember, and I'm sure most of you know this because I suspect there's a lot of mandated reporters on this call, but you don't have to have proof to make a report to DCF or whatever your state's Child Protective Service agency is. All you have to have is a suspicion or a concern to make a report. So just remember that you don't have to have repeated statements or proof of some kind in order to make a report. The most important thing is just that if you do have concerns, please make the report so that the right people can become involved to determine next steps. Next slide. So considering that you've maybe made a report, we want to talk about what happens next. It's also important to remember that all reports made are not necessarily assigned for investigation. DCF or your state's Child Protective Service agency will determine if the concerns reported rise to the level of being assigned for an investigation. There may be situations where they need to reach out to the reporting party to gather additional information in order to make that decision. So it's really helpful if you're able to provide your name and phone number when making a report. You know the child better than the people screening the report. So it's important to provide that information in case clarification is needed. If the report does rise to the level of being assigned for investigation, then a worker within the child's residence or within their county will be assigned to make contact with the family to assess the concerns. In my experience, they're typically going to make contact with the child first, so they may come to the school or to the home or wherever they know the child to be. So you'll oftentimes, when making a report, be asked to include information about where the child is located, and that's to assist Child Protective Services with knowing where to go to locate the child. Once DCF becomes involved, they'll determine the next steps that happen, which may include a referral to the local child advocacy center, and law enforcement may also be involved in helping to make those decisions. Next slide. In case you're not familiar with child advocacy centers, I just wanted to provide a little bit of background information about what a child advocacy center is. It may be referred to as a CAC. So if you hear that acronym, that's what it may be referring to. But a child advocacy center is all about teamwork. It's about bringing together all of the professionals who are involved in a child abuse investigation and centering all of those professionals around the family and around the child so that children and families don't have to bounce from agency to agency. It brings everybody together in one space to collaboratively work together on serving the child and their family and doing that in a trauma-informed way. Next slide. I recognize that this may be difficult to read as it's very small, but I have included the link for you to be able to access this information. But this is a map for Kansas to just show the counties that are served by child advocacy centers, and then it's color coded to show which child advocacy center serves which county. So you should be able to find your county and then find the child advocacy center that serves your county. So I just wanted you to have that information. Next slide. So child advocacy centers work as a multidisciplinary team, which we refer to as an MDT. So at the center of that team is the child and family, and we are all, like I said, surrounding the child and family to come together and work together while keeping the family at the center of everything. In comparison to maybe a school situation, it might be similar to like an IEP meeting where you have different disciplines or different professionals all coming together to develop a plan for a child. So our approach is somewhat similar where we have different disciplines that are all coming together to serve a family. We also kind of view this web as kind of like a tire, right? So each discipline is a spoke within the tire. When we are all connected and all working together, we have a smooth ride, a smooth journey for the family. But if one discipline is not involved or is missing or is left out, then our tire goes flat and it makes the journey for the family a bit more challenging.